What's up, guys? Dr. Jesse, Superior Physiotherapy and Performance. Today, let's talk about knee pain. Talk about why your knee hurts and what you can do to fix it, okay? If we think about our knee, it's one of the most simple joints in our body. It's a hinge joint. Think about a door, right? The door is bolted to the frame. The door opens, the door closes. Opens, closes. Not much else going on besides that. So our knee joint, when it's open, we're here, closed here, open, closed. Behind me here, I have a graphic. This is our femur, our thigh bone, and here's our tibia, our shin bone, and this is supposed to be our kneecap from the side, okay? Here at the bottom, same thing, femur, thigh bone, kneecap. Like we said, what's supposed to happen at our knee is essentially just open, close. Well, if we're not as strong as we should be in our hips, then you get some rotation and some abnormal pressures here in the knee joint, particularly with the kneecap on our femur and our tibia as we move. And then you end up with things like patellofemoral pain syndrome. So if we're not as stable as we should be up the chain in our hip, then it usually leads to the knee pain that you may be experiencing yourself. Can feel like a pinching behind your kneecap, some clicking, popping, catching, just general dull ache at the end of the day or after a lot of running, squatting, bending, that kind of thing. So that pain here is going to be, in this knee area, sometimes right around that kneecap, okay? And what you're going to do to fix it is you're going to strengthen up your hips. So today I'm going to show you 3 different exercises I like to use that help thousands of people with their knee pain, all right? Let's get to it.